Welcome, everyone, and thank you for joining us tonight for COVID-19 and Cancer. It's a virtual open forum for patients and families. I'm your moderator for the evening, health journalist Ileana Bravo. We have a distinguished panel of experts joining us from Sylvester Comprehensive Cancer Center tonight and UHealth, who can provide you with information about navigating cancer care during this pandemic, as well as the latest safety measures that are being taken to ensure patient safety across the health system. First and foremost, we want to thank all of you, the patients and families who are taking time out tonight to be a part of the forum, because at the end of the day, this is for you and about you. Some of you have already submitted questions regarding COVID-19 and cancer care prior to the session, but if you didn't submit a question, no worries, you have plenty of time. You can still ask the panel questions by using the Q&A feature at the very bottom of your Zoom screen. You can see the little icon that has little question boxes. They're all going to be anonymous, and we are going to continue to look at them throughout the presentation so that we can tee them up for our experts. Now, we want to tell you that to protect patient privacy, please keep your questions general. Don't ask anything specific with an individual's case or name or type of treatment. And again, enter your questions as you think of them. We're going to forward them, and we're going to get as many questions in as possible. We ask you to be proactive throughout this discussion because it's for your health, it's for your safety, it's for your peace of mind. So please be a part of it because we're here to help. And I do want to mention also that the session is being recorded, and Spanish translation will later be shared on Sylvester's social media channels. En español les quiero informar que este programa se está grabando y estará disponible en los canales de redes sociales de Sylvester Cancer. So it's time to introduce our panelists, and I'm pleased to introduce our first panelist, bringing us the latest on coronavirus, Dr. Bhavarth Shukla, Director of Infection Control for UHealth. Dr. Roy Weiss, Professor of Medicine and Chairman for the Department of Medicine, who will be talking to us about the latest treatments for COVID. Also joining us, Lauren Jolie, Assistant Vice President of Oncology Services for Sylvester. Dr. Alvaro Alencar is a hematologist oncologist at Sylvester and also medical director of our inpatient units. Next up, Dr. David Lang, who's medical director for emergency medicine at UHealth Tower. And from the patient perspective, joining us is Anne Llewellyn, who serves as an advisor on Sylvester's Patient and Family Advisory Council, and Anne is a survivor of central nervous system lymphoma. Jessica McIntyre is the Executive Director of Clinical Operations at Sylvester, a nurse practitioner and co-chair of the Patient and Family Advisory Council. And last but not least, and leading us in the charge for our discussion tonight, is the Director of Sylvester Comprehensive Cancer Center, Dr. Stephen Neimer. Take it away, Dr. Neimer.
Thank you very much, Ileana, and good evening, everybody. Thank you for joining us tonight. You know, first of all, we hope that all of you are well, safe, and doing well in these very troubling times. We're in the midst of a pandemic, and what we hope will be reassuring to you tonight is to be able to provide you with information, to provide you with data, to explain what's going on and how we're dealing with this at Sylvester so that we can continue to take care of cancer patients in the exemplary way that we've done for many years. The treatments that we're giving now continue in terms of radiation therapy and chemotherapy, surgical procedures, and we've done many, many things to make sure that the environment is safe for our patients and also for our healthcare workers, physicians, nurses, others who are intimately involved in delivering care to patients. It's been estimated that there may be 50 to 60,000 people out there who have cancer and don't know it because they've been either afraid to seek medical attention or they have not been able to get the tests that they need, mammography, colonoscopy, and other ways that we often use to detect cancer in its early stage. And so part of our mission tonight is to explain what we're doing here at Sylvester to make it safe for you. knowledge is the most powerful thing that we have. And when this pandemic entered the United States in March, we really didn't know the relationship of COVID to cancer. We do know that people who have a suppressed immune system may not do as well with COVID as those that are healthy and younger. But we have been very much at the forefront of developing registries so that we follow patients with COVID and cancer. We understand exactly which cancers or which treatments could predispose people to getting COVID, and we learn how to more effectively manage the infection in patients with cancer to prevent a serious illness. And so tonight you'll hear a lot about the various clinical trials and other things that we're doing here at Sylvester, being the only university-based cancer center in our region. And so we have a very important mission to understand how COVID affects cancer patients, and also to make sure that the average cancer patient who does not have COVID can safely maneuver through the complicated journey cancer patients need to go through in order to be cured. So Ileana, I'll give the floor back to you, and we're all available for you.
Thank you very much, Dr. Neimer. Let's turn it over to Dr. Shukla now for a COVID-19 update. Dr. Shukla.
Sure, thank you. I think that, as Dr. Neimer mentioned, we continue into this pandemic, and I know that many things have changed, and there's been a lot of numbers and things like that that I'm sure many people have read about. And some of the biggest questions we get now is, is this a second wave that we're experiencing? And if you look carefully at the numbers, it really seems like more of a continuation of what already started in March. And the numbers tend to fluctuate after that, but there hasn't really been any second wave, so to speak, in the sense that the numbers haven't gone away. And so basically what that means for us as citizens is that we need to learn the best ways to care for ourselves, continue the care that we need for cancer and for other illnesses in the midst of this pandemic. And I think that one of the best things that we can do is, as Dr. Neimer mentioned, continue to follow all the safety precautions we can for our patients and our staff. Another of the common questions that we get is regarding how this disease is transmitted, how do you get it, and how do you stay safe from it? And one of the things that we do know, and that has been known from the beginning, is that the virus spreads by droplets, which are very tiny droplets of fluid that can come from a patient who's infected. And those droplets can be transmitted through the air, and they can be transmitted on surfaces. And so those are the primary means that we know that the disease can be spread. To that effect, however, we do know that there's very good mechanisms that can help prevent that spread. Many of the other parts of the country who have had large surges are a perfect example of how these sort of protective measures can prevent continued spread and reduce numbers in the community. The biggest one, obviously, is to wear a mask. I think that message has been very clear from the very beginning. Wearing a mask around others, particularly when you're going to be around people you don't know, but also even people you do know and trust, because you're not sure what they do when they're not around you. So wearing a mask at all times is probably the most important thing we can do. The second most important thing is to avoid crowds. We do know that in large crowds, there can be large numbers of people, and people are closer together in those situations, and so the droplets can spread in those environments. So avoiding crowds is another very important thing for all of us to observe, particularly patients with cancer or immunosuppressed states. And then the final thing is that making sure that you do really good hand hygiene. And what that means is washing your hands with soap and water. Regular soap and water are very effective against killing this virus. Or using hand sanitizer with alcohol is also perfectly acceptable. But doing that frequently, and particularly so when you need to touch your face or eat. Those are the most important things, because the virus has to be transmitted from your hand, from a surface to your hand, and then you have to then move it to your mouth or your nose. So always remembering to wash your hands before you touch your face or eat is another very protective mechanism. So I think those are kind of the key points that we get asked. And I think that if we adhere to those, we know, as I mentioned, in other cities in the country, that the transmission can be curbed with these simple methods.
Thank you, Dr. Shukla. I don't think we can hear it enough, right, in today's messaging. We have to keep hitting people over the head with it. Next up is Dr. Weiss, who will share a brief presentation on the latest treatments for COVID-19. Dr. Weiss.
Good evening, everybody. It's my pleasure to speak to you this evening about some of the therapeutic maneuvers that we're doing for patients that have become infected with the COVID-19 or the coronavirus. And so this is really a race to end this pandemic, and everyone is involved in it. And one of the most important aspects of our race to cure is the concept of a vaccine. You can't pick up a newspaper today without reading about how we're promised to have vaccines, how you could invest and increase your stock portfolio by investing in companies that make vaccines, because vaccines clearly are one of the most important armamentarium that we're going to have in order to combat this disease. Why are vaccines necessary? Well, firstly, the SARS-CoV-2 virus is highly transmissible by the respiratory route, as we just heard. And the infections can be very serious as it infects the lungs, and we know it can affect other organs of the body as well. What's so interesting and potentially problematic with this virus is that it can be transmitted by people who have no symptoms whatsoever or before they even get symptoms. And this is why it can become an endemic infection where it reaches a steady state. The concept of herd immunity, which comes from the 1930s when we were immunizing children against measles and thought that there would be protection from measles, this is not really a concept that will be applicable to the COVID infections, because herd immunity is not likely to happen because people are going to be, and we don't even know who the people are that are necessarily spreading the virus. And our ability to remain immune to the virus isn't forever. It's usually a finite period of time, and we're still trying to understand how long that is. And of course, vaccines are necessary because we must end this pandemic because of the major economic and human impact that we've had of the virus. Now, there are about 5 different vaccines that are available for treating infectious diseases. This evening, I want to talk specifically about the RNA vaccine, which is the one that you might have been reading most about in the newspapers, and that's the one that the Moderna company has put out, and the University of Miami will be the site for 1,000 patients to try this RNA vaccine. Yesterday, in the New England Journal of Medicine, the first published report of this vaccine was made available. They tried it in 45 patients, and they showed that it resulted in what we call neutralizing antibodies in the different individuals. Furthermore, the vaccine was very safe. How does the vaccine work? Well, the virus is an RNA virus, and what happens is that we take a piece of the RNA, which is the nucleic genetic material of the virus, not the entire virus, but just a part of it, and we take this RNA and we encase it in lipids or fat. And that's important because that's the way in which this RNA gets incorporated into the cell. It then gets into the cell, and the RNA then is treated like any other RNA of the cell. It doesn't cause disease, but what it does do is it specifically makes a certain protein, or antigen we call it, and that antigen then gets exposed to our immune system, and then we make antibodies to it. So then when the time comes that the virus gets into our body, the antibodies are already there and can fight and eradicate the virus. That's the idea. And that's what this Moderna vaccine and other vaccines that are coming down the pipe are allowing us to do. It's an RNA vaccine where the RNA gets incorporated into the cell. It doesn't cause disease. It's just a piece of nucleic acid making proteins that then stimulate the immune system. There are also DNA vaccines, which we won't go into. And then there are vaccines that are being developed where they take the unique proteins of the virus, and we inject those proteins into the body, and that stimulates an immune response. And that immune response is already revved up, waiting to go to neutralize any viruses that would come into the system and cause disease. There are virus-like particles which have also been developed, and there's about 20 different types of vaccines that are being developed. The first one to hit the so-called the public will be this Moderna virus, and as I said, the University of Miami is all prepared, and we are welcoming 1,000 patients into this trial. Now, in addition to vaccines, you might have heard a lot about drugs that can be used to fight the virus once we get it. So bear with me for a second. This is a cartoon of how the virus gets into the cell. This big red blob on the upper left is the depiction of the virus, and the blue wavy line that you see is what separates a cell of the body from the blood of the body. So this virus comes in, it hunkers down on the membrane of the cell, and like a dump truck, dumps its entire genetic material into the cell. And then once it gets its genetic material into the cell, it takes off, it sort of controls the whole operation. What happens is that DNA then forms proteins, and the proteins then go ahead and form more virus. And then on the right, you can see the virus, new virus is being formed and then released into the blood. Now, we have drugs that can inhibit the binding of the virus to the membrane, so it doesn't even get in the cell. And we can, for example, hydrochloroquine, or Plaquenil, which has been used, although we don't use it anymore now because of the concern about the cardiotoxicity of it. It can interfere with the fusion of the cells, the fusion of the virus into the cell. But most importantly, we come to a drug which we are using quite a bit of, and that's called remdesivir. Remdesivir specifically inhibits a viral protein called RNA-dependent RNA polymerase, and that poisons the virus and prevents the virus from replicating. This is an FDA-approved drug. We have it here at the University of Miami on an aliquoted basis, and it has been shown in clinical trials to decrease the length of hospitalization in patients that have been infected with the virus. One other thing I'd like you to note is that once the virus leaves the cell, it forms an inflammatory reaction. And this inflammatory reaction we call it cytokine storm. And this cytokine storm can be prevented or modulated by the use of various drugs that some of you may be familiar with, which is used in treating the same sort of cytokine storm in bone marrow transplant patients, called tocilizumab. And that's up here at the very top. So tocilizumab is also used to prevent the inflammation that might occur in response to the virus. Lastly, there's something called convalescent plasma that you probably have heard about. So once somebody gets the COVID virus, they develop their own antibodies to it. We don't know how long those antibodies are protective for or whether they can even neutralize the virus. But this has been a very effective protocol used in Ebola virus, for example. And although we don't have all the data yet in COVID virus, we are using convalescent plasma in the treatment. And the idea is that somebody who has been infected with the virus and has recovered means that they must have antibodies of some sort in the blood, hopefully neutralizing antibodies. They become blood donors. We then take the plasma and match it to the blood type that's appropriate, and then we give it to the patient. The idea would be that a patient, either before they get the COVID, but we're using it now specifically in patients who have known COVID infections, will neutralize the virus and prevent it from entering into the cell. So we also are using convalescent plasma. If I could make a small advertisement here, we are in desperate need of donors, individuals who've known they've had the infection, so that they can donate the plasma. We have no dearth of people who need it, but we are somewhat limited in the donors. And lastly, in order to protect you, our valued patients and friends, we want to be sure that if you are infected with the virus, that we're able to monitor you safely during the course of your illness. So we have a very high-tech telemedicine application where we're able to monitor individuals who are positive, or if they have symptoms, or if you're somebody who's high risk because you're getting chemotherapy and you have you want to be monitored closely by your doctor, but don't want to come into the clinic, we have an opportunity to monitor you. And if you're positive, we don't want to necessarily expose our healthcare workers to that. And so, or captive audiences, for example, in whom physical distancing is not possible. So we call this telegilance, and it's a device that we have that it's not just simply a video or a telemedicine visit. It comes with a temperature monitor, a pulse oximeter, a blood pressure monitor, but it also comes with a stethoscope that allows your doctor to listen to your lungs in very good clarity, listen to your heart. It can look inside your mouth with beautiful graphics and visuals at high resolution, can look in your ear, can look at your skin. It's the next best thing to being there. And so we provide this to our patients in order to be in the ones that are indicated, in order to be sure that we have this telegilance aspect. And with that, I'll conclude, and thank you very much.
Well, Dr. Weiss, thank you very much. And I think you made some news because there's a flurry of questions about the vaccine trial. So I believe, to reiterate what you said, that will be one of the vaccine trial centers, and I believe you said 1,000 patients. So obviously this patient population is interested in finding out whether they as survivors could participate in a vaccine trial.
So indeed, we'll be starting the trial in August. We're just revving up all the facility and so forth in order to do so. And the actual inclusion criteria, because if they're looking at this primarily for safety as well as efficacy, there'll be certain age limits and certain other comorbid conditions that will be potential exclusion. But we'll be able to post that information on our various websites, and we would welcome participation of everyone who's eligible.
Thank you very much for reiterating that, Dr. Weiss. And I think the patients and families know that by going to sylvester.org and so forth, staying on top of the resources and the information, they will disseminate that information as soon as it's available. So I want to remind all of you that we have the Q&A little button at the bottom of your Zoom screen for all of you to continue to submit questions to us so we can give them to our presenters. So let's jump right into our very first question for Dr. Alan Carr, and that is, right now there are no visitors allowed and staffing has been adjusted. Why is that?
Thank you, Liana. And it's one of the toughest parts of taking care of our patients right now is the need for social distancing. As Dr. Shukla described, one of the most important things that we have as a way to prevent the exposure or the transmission of the virus is really maintaining our distance. And it is extremely challenging for us because cancer care is teamwork. And mainly when you come to an academic center, you used to see big groups of providers coming over to see you because you have leaders in the field that are teaching the next generation, and you have multidisciplinary care, and all of a sudden all this seems to have disappeared. So everything that is being done, and one of the main things in this is really avoiding more people than really needs to be in the center right now. So we want to make sure we continue caring for patients. It's crucial that we continue our mission there, that is treating cancer and curing cancer. That is fundamental. But one of the most important things is how can we avoid unnecessary exposure for our patients, for our providers, for our staff? So one of the ways to do this is minimizing the number of people who are coming to the center. So if you have a family member and that typically comes with you, right now we're unfortunately not allowing this person inside, but still we want to make sure that this person is part of the care the same way. So we may call from the room where we're examining the patient. We'll try to have a telemedicine visit or a FaceTime or a Zoom visit with the family who's home, or sometimes it's the parking lot, to make sure that we still find a way to involve the entire family in the care of these patients. And this also happens in the hospital, in the inpatient setting. A lot of times we have patients who spend quite a long time in the hospital, and unfortunately now we're not allowing visitors either. It's the same principle. How can we minimize the number of people? How can we minimize a visitor who might be an asymptomatic carrier to bring the virus inside our hospital? But the same way, we're making sure that we still keep close communication with the family. So contacting families on a daily basis, making sure that the patients have a way to communicate with their family members, and making sure that family members can ask questions. We ourselves were even, I could feel this myself. We had a family member who had to be hospitalized in a different hospital, and we only had access to information once a day. So we understand how difficult it is, but it is crucial that we really minimize the unnecessary exposure to our patients. That's the only way that right now we can safely provide our care.
Okay. Dr. Neimer, here's a question that's coming from a patient also. Are nurses and staff being tested regularly? And if not, why not?
Thank you. Let me just add to what Dr. Alencar said, which is that we've done a number of things to reduce the number of people in our facilities. And so, for instance, not having people in a waiting room, the chairs, every other chair generally has been removed from settings so that it's not even physically possible for people to be aggregating. And because we've work in sometimes small exam rooms and things like that, it's not been possible to keep all the visitors out of the room or in the room and still maintain the social distancing. We have followed the CDC guidelines, and one of the things that we're very proud of, which you've heard about, is the ability to protect ourselves as hospital employees from getting infected. So you hear PPE all the time, personal protective equipment, and for instance, in the Northeast, at the beginning of the pandemic, there were not enough masks to go around. There were not enough of these N95 masks. There was not enough sanitizers and wipes and things like that. And we've been very fortunate. We have an excellent, what we call supply chain, that provides us with all of this equipment to keep our employees safe. And so we monitor for symptoms. So anybody who's not feeling well, it does not come to work. And so that's a very important method that we've used across our entire campus to make sure that nobody who's sick comes to work. And the other is, if you walk around our campuses, you'll see that everyone is wearing a mask. People, depending on what you're doing, are wearing face shields. And if anybody has symptoms, we have a phone number that you can call, and you can then be eligible to be tested for the virus. We've also done some testing across the board in our employees to see if people have antibodies, what's called a serologic test, meaning that you may not be actively infected, but did you have any evidence that in the past you've been infected? And when we did that, we found very few of our employees had been exposed in any way, even those that are taking care of COVID patients. And so we have a system that protects our employees from getting sick, and the corollary of that also by having all of our patients wear masks in our facilities, we have not been in a position to transmit virus to our patients, and so we've been able to keep it safe. The testing internally that we've set up is very robust. We have 17,000 employees, and so if you wanted to test everyone every day, it would really, even if you were open 24 hours a day, you'd have to be doing about 700 people every single hour every day to keep everybody tested. It's just not practical. And so we're taking every measure short of that to make sure our environment is safe.
Thank you, Dr. Neimer. So Lauren, along the topic of visitors, if you could just very briefly address, how will loved ones be notified on the status of a patient's care since they're not allowed to join them on the appointment? Just real quickly how that'll happen.
Thank you. I'm going to echo a lot of what Dr. Alencar said. First, we recognize that this is very, very challenging. Our staff are aware how challenging it is and are sensitive to that. To facilitate loved ones' involvement, we really encourage loved ones to join via video or conference, phone, whatever method we have available, to really engage them in the conversation, in the decision-making, and in the discussions. In addition, to facilitate movement between visits or to visits, we have staff assigned to assist building navigation and mobility because we know that that's a concern to many of our patients' loved ones. And finally, I'd just like to point out we have an amazing and caring staff that have really continued to provide excellent care to our patients throughout this pandemic, and will continue to do that. And we're here for you all. We're here for your patients, we're here for the loved ones, and we'll continue to support them even in the visitor absence.
Thank you, Lauren. Dr. Lang, a question: as a cancer patient, is it safe to go to the emergency room?
I would say absolutely. We have put up several triage areas when you first come to the emergency department. For number one, does the patient have symptoms of COVID? And then for years now, we have been asking every patient that comes in if they're a cancer patient, if they're a Sylvester patient, because we need to know where to put the patient appropriately. One of our challenges is to separate out the cancer patients, the ones that are immunocompromised, from patients who may have a possible COVID infection or any other infection. So we have developed separate areas of the emergency department for patients that likely have COVID and for patients that are less likely to have COVID based on symptoms. We have significant negative pressure rooms for COVID patients who need to be isolated. We have an outdoor tent where we can put patients who are not as sick but may have COVID, so we can keep them actually out of the physical emergency department and allow our oncology patients, our other medical and surgical patients to be seen in the emergency department with less chance of getting an infection. The other area that we look at is, other than preventing patients from catching an infection, we try to prevent the patients from giving us infection. So as been said before, with our patients, our department was one of the first in the hospital to wear masks 24/7. We have the full PPE that we have never run out of. And we're probably one of the few facilities in this area that have maintained an adequate supply of N95 masks, of PPE. And we've established very robust protocols on how to manage the oncology patients when they come to our emergency department. Laura and I worked on years ago for neutropenic fever on how to deal with those patients and how to manage them quickly, make a decision, and treat them quickly. So we have to maintain almost 2 separate ERs, one for COVID patients and a separate emergency department process for those that do not have it.
Okay, thank you, Dr. Lang. And as we proceed with more medical and clinical questions, I'd like to bring in Jessica and Ann to discuss sort of patient advocacy, the Patient and Family Advisory Council. Jessica, can you tell us what that's all about?
Sure, Liana. Thank you so much. And welcome, everybody. The Patient and Family Advisory Council for Sylvester is a safe forum that provides opportunities for patients and families to engage in improving the patient experience at Sylvester. You have the opportunity to share feedback, suggestions, ideas on how we may improve Sylvester. Ultimately, we want the voice of the patient to be pivotal in the changes and improvements being made. We want to make sure that your feedback is taken and that we definitely align with what patients and families need in respects to cancer care. We meet once a month and we discuss a lot of projects, things being happening within Sylvester and across UHealth. And actually, Ann is one of our patient advisors and can give you a little bit more about that experience about being a patient advisor and also about being a patient during the pandemic using telemedicine. Ann?
And unmute your screen. There you go.
Thank you, Jessica, and thank you for letting me be here tonight. And definitely, I am a cancer survivor. I had a central nervous brain tumor in 2014 and received my treatment at the Sylvester Cancer Center. And thank God that's why I'm alive today. So I really do appreciate everybody here and the people who are working at Sylvester for all of us. But being a patient during this time is challenging. But one thing I would say is we have the technology today to help us still to be informed and to be educated. So don't be afraid to ask your team, whether you're in the hospital, whether you're an outpatient, to use that technology. Telemedicine. I had my first telemedicine visit last week with my hematology oncologist, and it was great. I mean, I was worried about coming down there and thinking I was going to have to go to the cancer center and wait and be exposed, but I was pleasantly surprised. The appointment took place right in my kitchen. It was on time. The doctor was there and he answered all my questions. He asked me how I was. I didn't have that technology to get examined, to have, blood pressure and everything, but I think if I needed it, I would have. But so far, it was a great experience, and I really appreciate being able to have it. As far as the Patient and Family Council, I've been serving on that for the past few years. And if anyone really is interested in helping to improve the healthcare system, improve what's happening in the hospital from a patient perspective, I really would recommend that you volunteer to serve on a Patient and Family Advisory Council. It's very eye-opening. You get to meet, Jessica has been our lead for the past few years. And if we on the panel have some questions, she will get the head of that department to come to the next meeting and we can talk about it. And we can understand why things are the way they are and how things can be improved. So it's been a really wonderful experience for me. And we've seen some great changes happen because of it. And we are the patients and they want to hear from us and they want to hear from our families. So if you're interested, I know Jessica can give some information on how to participate.
Thanks, Ann. Yes, if you're interested in taking part or being part of our Patient Family Advisory Council, you can email uhealthevents@med.miami.edu. Again, the email is uhealthevents@med.miami.edu. Thank you. Ileana, back to you.
Thank you, Jessica and Ann, both. Very important, the holistic approach and the patient point of view. Very important tonight. So Dr. Alencar, I am going to give you a twofold question here. Am I more susceptible to the virus if I'm on targeted therapy? And second part of that question is, should I start chemo during the pandemic?
All right, so the addressing the first question, we're still learning a lot of what exactly, who are the patients that are more susceptible or less susceptible, but what we know with targeted therapies, that targeted therapies sometimes have, as the name says, very specific targets and may cause less problems with immunosuppression, less issues with the toxicity that we typically see from chemotherapy. But targeted therapy can still be immunosuppressive. Targeted therapy can still increase the risk of infections. So, but it's such a general term for so many different agents with so many different targets that the best way is to discuss with your doctor and see whether that is specific drug that you are planning on getting, whether it would increase your risk of infections. But it is so complicated right now, as for example, this class of agents called BTK inhibitors. I'm sure there are patients here in our audience that are receiving a drug called ibrutinib for treatment of CLL. And we know that BTK inhibitors work in this inflammatory response that Dr. Weiss talked about. And it seems in reality that they protect from this very wild inflammatory response to the virus. So we are actually opening a study using this class of agents to treat patients with COVID. So there's still a lot to learn. And, but as we go, the most important thing always is to discuss with your doctor and see whether it is safe or not to proceed with therapy and what this would expose you to risk. So that goes to the next question is, yes, we're starting therapies every day now. We still need to be alive and free from cancer to get COVID. So we wanna make sure that cancer is treated. So for every single new case that presents to us and we have to consider therapy, we're balancing out the risks and the benefits. So if therapy can be safely delayed, we may delay therapy, wait to see what happens if things calm down, if the pandemic calms down, and we can safely delay therapy. But in some other instances, that is not possible. So we will proceed with therapy, make sure that we maintain all the safe mechanisms to avoid any potential complication. Every patient before therapy is initiated is tested for COVID to make sure you're not an asymptomatic carrier. If you are an asymptomatic carrier, in the majority of times we'll delay therapy until the virus has resolved. But we have, even in patients with positive tests, started therapy because the risks were outweighed by the benefits from treating. So that is the long answer to say that yes, we are giving therapy even in the pandemic.
Thank you, Doctor. Dr. Weiss, this is a question that we've read in the media, we've heard about this. Is it true that blood type is critical as to whether you do well if you contract COVID-19? Supposedly, blood type A is supposed to be more adverse than blood type O.
So there are reports in the literature that have looked at this, just as there are many reports about all sorts of things with regard to this disease. I think the bottom line is I would not feel comfortable thinking that if I had a particular, like blood type A, that things are cool, I don't need to be worried about getting the virus. I think we just don't know enough right now to draw any definitive conclusions about it. The jury is still out. And although there are some preliminary data suggesting there may be a relationship between blood type, I think at this point it's too early to have any comfort or knowledge in that area.
Okay, thank you. That is one that continues to bounce around. We have a couple of questions about pregnancy and COVID. What's the risk to the baby if mom is infected, Dr. Shukla?
So that's a good question. Surprisingly, so far, most of the data that we've seen in pregnant women has been favorable, especially when compared to pregnant women in flu, which is generally, the data for that has generally been non-favorable in terms of outcomes. But so far, what we see is that there's not any particular worse risk for pregnant women, at least from the preliminary data that we have. And again, as Dr. Weiss mentioned, again, this is very early information, so certainly could change. And then as far as risk of transmission to the newborn, there's been a few case reports of that having been documented, but we've certainly had a lot of people who have continued to deliver babies during this whole pandemic, and that has certainly been the minority of cases where that has occurred, just a few case reports. So that's kind of what we know so far, but I think things will change as we know more and as this pandemic progresses.
Thank you. Dr. Neimer, this one's for you. Some employees in my workplace have COVID and I don't feel any symptoms, but as a cancer patient, should I be tested anyway?
Thank you. The criteria for being tested, one, Dr. Alencar said that we're testing all of our patients before they start some treatment like chemotherapy or radiation therapy. If someone is going to have a surgical procedure, we test people before that. If you have had a contact with somebody who's positive, we do something called contact tracing. And the question is somebody a close contact or a contact? And so at the moment, we're defining a close contact as someone who you've spent 15 minutes with or more, and you've been within 6 feet of them, and you have not been wearing personal protective equipment. So if neither of you is wearing a mask, so for instance, if someone you know is positive and you had lunch with them and you sat down and ate for an hour and you sat next to each other, that would be a close contact. And close contacts of positives are either tested or told to self-quarantine. And so at the moment, if you have no symptoms, there's not a treatment for people who have the virus and have no symptoms. You would just be monitored at home. And of course, by quarantine, you would make sure that you don't pass on the virus to anyone in your family. One of the things we've done for our employees, which I believe is reassuring, is if people are concerned that they may have been exposed and they don't want to go home to their families, they have elderly parents that they live with, we have provided housing for our employees, usually in a hotel, which allows them to wait out that period of time until it's safe to return to the home.
Dr. Neimer, just jumping on something that you mentioned a moment ago, that there were specific types of cancer that are more prone to get COVID-19. Can you talk about what those are?
Yeah, so we're still learning more about which types of cancer and which associated risk factors, either the treatment or some other disease. So for instance, there's an understanding in multiple myeloma patients that one of the highest risk factors for unknown reasons is hypertension. So in fact, of all the myeloma patients, the ones that have high blood pressure are the ones that seem to be at higher risk for getting the disease. There are two diseases that sound almost the same, CLL and CML. And so far, it seems like CML patients rarely get the disease, whereas CLL patients may be getting the disease. And so these, like Dr. Weiss said in response to the blood type question, you have to be careful no matter what type of cancer you get, because there are no cancers that protect you from getting these. And also the immunosuppressive treatments may make it more difficult for your body to control the infection. So everyone needs to social distance, wash their hands, wear masks, and avoid, crowds and things like that. But we are learning more about which lung diseases, which cancers may predispose.
Okay. So along those lines of a cancer patient suspecting that they might be infected or exposed, Dr. Lang, can you address that? Where, as a cancer patient, do you go? Is it UMH? And what is the availability of beds and ventilators? Because obviously in the national news, it says that we are at capacity.
If you think you are developing symptoms, probably the first call should go to your treating team, the physician, nurse practitioner, PA, to discuss what you're feeling. If that team thinks that perhaps you should be tested, there are different testing sites. Lauren can actually probably give you more of the testing sites that Sylvester has developed. And University of Miami Hospital is one of the testing sites. So if a patient comes to us, We have the ability to do a swab to get a result in 4 to 5 hours for the most part through the emergency department. Most of the patients that we test that are positive go home. So let's start off with the vast majority of COVID patients are not admitted to the hospital. They do go home. As Dr. Weiss has pointed out, we have developed a new TELEVIGILANCE system that can also assist us with home health care. For the patients that are admitted, the numbers of admitted patients now are going up, every week a little bit. And we're maneuvering beds in the hospital to increase the capacity to take care of COVID patients. Right now, the question about ventilators, we have I don't have the exact number, but there are not many patients with COVID on ventilators at this hospital right now. So we have ventilators. The availability of beds changes day by day depending on the number of patients that we have with COVID and the number of patients that we admit without COVID. And that fluctuates on a daily basis.
Okay.
But I would Lauren would be the perfect person to discuss the Sylvester testing sites at all the satellites, so you're not having to drive all the way to the hospital.
Thank you, Dr. Lynn. We have developed some outpatient testing sites to serve our Sylvester and other patients, and we worked very closely with our testing committee to develop guidelines specific to oncology patients. The most common times that we do provide tests at these sites are for medically stable patients prior to initiation of treatment in one of our infusion centers, for radiation therapy patients prior to initiation of treatment, or for certain patients who have head and neck cancer specifically more frequently, and for people who are symptomatic and on active treatment. So those are the patient populations we focus on. We have one located on the main campus, one located at our Deerfield Beach campus. Both are in locations that are isolated from other patient care areas, and we spend a lot of time to ensure social distancing and limited exposure to patients and others that visit these sites.
Lauren, right up your alley, can you continue Herceptin infusions if someone has COVID?
We have many patients receiving Herceptin infusions. Typically, we will hold them during their active treatment of COVID. So if they actively are expressing COVID, that's a decision that will need to be made between the provider and the patient, and they'll typically be held. But if someone is receiving Herceptin treatments as part of their maintenance or active therapy plan and are COVID-free and symptom-free, we have many patients receiving.
Wonderful. Okay. Dr. Shukla, here's a question from, I guess, people who have been to Sylvester and they're wearing their own masks and they bring them from home, yet you hand out disposable masks upon entering. Tell us why that is.
Sure, that's a good question. There are a lot of handmade and cloth masks out there. And usually I think they're great for the community. And so we don't discourage using them. But when you're walking into the hospital environment, we're anticipating you may be there for a while for your treatments, for your consultation, etc. We know that the medical masks that we have are better at keeping people from retaining moisture. And so that's why we ask the patients to switch out and wear the medical masks that we have. You can continue to wear your cloth mask as you exit. You can switch back out to your cloth mask. But that's an excellent question. So that's the primary reason why we do that. And then also to maintain consistency. Some patients may not be able to bring a mask. Some people may not have the right type of cloth mask. They might have holes in it or may be made from inferior materials and so forth. It's just a lot easier to say, for consistency, we know this is a medical grade mask. It's going to protect you and protect us. And so that's what we ask, to switch it out. And then certainly you can wear your own on your way out. Better
safe than sorry, knowing that yours are approved and ours may not be. Dr. Weiss, I just want you to sort of do a quick synopsis of what you were saying on the COVID treatments, which the two highlights I picked up is how remdesivir is proving to decrease hospitalization for infected patients and how important and critical the need for convalescent plasma is for treatment of patients.
Right. So we don't exactly have an antibiotic for the virus. What we do have is a drug that is known to attenuate or slow down the virus in the body, and that's remdesivir, and it works by inhibiting a certain enzyme that's very unique for this virus. It is somewhat limited in availability. We, thank goodness, have plenty of it in hand right now at the University of Miami Hospital. And that's one drug. There's also another drug that we're using called dexamethasone. Many of you who have cancer might have received a form of a steroid during part of your therapy, such as prednisone or something like that. And we believe that is one of the drugs that helps reduce the inflammation and can protect the lungs during the lung involvement of the disease. In an effort to help the body fight against the virus, the concept of convalescent serum is in allowing sort of passive immunity, in the sense that we use somebody else's plasma who has been exposed to the virus and has the antibody, and use their antibody to help you fight the virus.
Okay, Dr. Weiss, thank you. And Dr. Neimer, I think we're almost getting to the end of this forum, which has been incredibly important for patients and families to listen to. And we're going to ask you for a wrap up and closing thoughts. But one of the things that people are out there so concerned about is sort of daily living. And, you know, someone who's been in their home and doesn't even go out to get groceries and is a cancer survivor with low white blood count, is it okay to go to the store? Do you stay in your home forever? You know, those are the kinds of concerns we're hearing.
Right. Well, I can say that you don't need to stay in your home forever. That part will be for sure. You know, cancer patients are used to, especially if they're on treatments that lower their white blood counts, are used to being careful about what they eat, careful about where they eat. And so you know, this is almost part of the wrap up, but, you know, although the virus is invisible, you can't get it from nothing. You have to get the virus, you have to be exposed to somebody who has the virus for a long enough period of time for them to transfer for you to breathe it in, basically, or get it on your fingers, and then you touch your eyes or your nose or your mouth. And so one, of course, has to follow all the local laws, whether restaurants are open or not open, or just delivery and takeout, whether there's a curfew or not a curfew, whether the beaches are open or parks are open or not. You know, taking a walk is a wonderful thing, especially there are lots of areas, there's such beauty down here in South Florida, to take a walk with your family in a way that's protective is great. And, you know, different people have different levels of concern. We are very focused on mental health as well. You know, the isolating effect of these whole policies, the no visitor policy and other things, that we want people to not be so afraid that they can't take care of their overall health. And so if you're going to go to the supermarket and you know that it's really crowded at 10 o'clock in the morning, you know, don't go at 10 o'clock in the morning. And many of the other very limited activities that one can do. My wife and I sometimes, you know, have a big outing and we go to a restaurant to pick up food. So I think it's, the things have changed. If we look at other states, if we look at other countries, we should see the other side of this. But in the meantime, when there's so many people infected, and we know that asymptomatic people can you know, wear a mask, be careful, avoid crowds, but, you know, people have to get out and get fresh air. People have to get some exercise. People have to get food, and people have to take care of their families. So there's always a level of moderation in everything that we recommend.
Yeah. So I guess low risk versus high risk behavior. If you had to sum it up in a couple of sentences, any of you, Dr. Neimer, any panelist, what would it be in a nutshell?
Bavarth,
Sure, yeah. I think the highest risk behaviors are if you take the number of people and the farther you multiply it, the higher the risk of behavior is. So if you're hanging out in a crowd with 50 people, that's for sure very high risk behavior. If you're in a small setting with your 2 family members, it's probably much lower risk behavior. As Dr. Neimer mentioned, if you're going to the grocery store, same concept. If you're going at a time when it's very crowded, that's probably a higher risk behavior. If you go at a time, a lot of the grocery stores have set time for folks who are immunosuppressed or elderly now. If you go during that time and you know that the number of people in there is going to be fewer, that's a lower risk behavior. So I think the good sort of rule of thumb is the number of people. The lower the number of people you're interacting with, the lower risk the behavior is.
Anybody?
Now wearing a mask is a very high risk behavior.
Oh yeah, well, I mean, absolutely, yeah. I mean, wearing a mask at all times. I never leave my home without a mask and a hand sanitizer bottle because you never know if you're going to run into someone all of a sudden. You have your mask right there. So in the community, I think that's absolutely the most important thing: carrying your mask, carrying your hand sanitizer, and obviously avoiding the number of people, as many people as you can.
All right. Anybody else on the panel before we wrap it up that want to say some take-home message and words to all of our dedicated panelists and patients and families here tonight with us?
Right, if I may, one of the things that we all noticed over the past few months were people actually avoiding going to the emergency department, putting off needed medical care. And, there was nationally, the American College of Emergency Physicians and different healthcare organizations, put up notices that, the emergency department is safe. It's designed to be safe. But putting off necessary and needed medical care is dangerous and can be and could be dangerous. So we're here for you, but take the precautions as everyone has said. If you're going out, wear a mask, wash your hands, don't touch your face, avoid large crowds, but don't put off the needed medical care by avoiding the emergency department for a low risk of catching COVID.
As good a take-home message as there ever was. Thank you all so very much, Dr. Lang, Dr. Alencar, Dr. Neimer, and Jessica, Lauren, Dr. Shukla, Dr. Weiss. Very informative, very important for our patients. And I want to thank all of you who participated tonight, all the patients and family, for entrusting Sylvester and UHealth with your care. We're here for you. Please visit sylvester.org to learn more for virtual or in-person appointments. You've heard all of the safety measures that are in place just for you. And keep an eye out for additional resources. Check your email inbox to see what else you get in the next few days from Sylvester and from UHealth. We hope that you found tonight's session informative. Thanks for all the questions and answers. Please complete the survey at the end of our talk tonight because we want your feedback and want to hear about other topics that you're interested in. So have a great evening, everyone. Thank you, everyone, tonight. And please stay safe out there and wear your masks. Good night.
Good night.